Chapter 2 Patient Registration. Topic Service Agreements and Review of Service Agreements. At the end of this chapter, the learners should be able to define the meaning of service agreements and review of service agreements, the concept of test request forms or TRF generated by the referring physician and those generated by the labs, system of lab numbering and unique identification, and the need for informed consent. The ISO 15189-2012 says that laboratories must have documented procedures for the establishment and review of agreements for providing medical laboratory services. Each request accepted by the laboratory for examination is to be considered a service agreement. Agreements to provide medical laboratory services shall take into account the request, the examination, and the report. The agreement shall specify the information needed on the request to ensure appropriate examination and result interpretation. The following conditions shall be met when the lab enters into an agreement to provide medical lab services. The requirements of the customers and users and of the provider of the lab services, including the examination processes to be used, shall be defined, documented, and understood. The laboratory shall have the capability and the resources to meet the requirements. Lab personnel shall have the skill and expertise necessary for the performance of the intended examinations. Examination procedures selected shall be appropriate and able to meet the customer's needs. Customers and users shall be informed of any deviations from the agreement that can impact upon the examination result. Reference shall be made to any work referred by the laboratory to a referral lab or a consultant. Reviews of agreements to provide medical lab services shall include all aspects of the agreement. Records of these reviews shall include any changes to the agreement and any pertinent discussions. When an agreement needs to be amended after the lab services have commenced, the same agreement review process shall be repeated and any amendments shall be communicated to all the affected parties.